Um, Assalamu alaikum and good afternoon from Malaysia. And I'm really thankful to Professor Munira for giving me this opportunity to talk to this august gathering of academicians coming from Malaysia, India, and Oman. Right, as Prof has already mentioned, we are going to talk about integrated clinical education, and we will have some activity related to this topic as well. Let's look at the learning outcomes first. It means that what actually we want to achieve from this session. The first is that the participants would be able to explain the concept of integration in the clinical education. I think that would be the important. Once we have the right concept, the rest of the things would be relatively easy. Next is different levels of integration. We know that there are different levels of integration, and we will quickly go through that, so you will have a clear picture on that. And then there would be a plan and integrated clinical education session. This would be our hands-on activity, and also draw a timetable of an integrated module. This would also be an activity, and actually this is quite useful, the activity and the attribute to implement an integrated curriculum. So integrated timetable is an integral part of it. And then assess the students based on principles of integration. This would be a short thought about how to assess students while we are implementing an integrated curriculum. So these are the learning outcomes which we will achieve, inshallah, in this session. So let's talk about the concept first and try to understand it. So here is one definition. A fully synchronous means real-time, transdisciplinary delivery of information between the foundational sciences, here maybe the basic sciences, and applied sciences means the clinical sciences, throughout all years of a medical school curriculum. In other words, a fully real-time transdisciplinary delivery of information between basic sciences and clinical sciences throughout all years of a medical school curriculum. That is one definition. Another definition, the organization of teaching matter to interrelate or unify subjects frequently taught in separate academic courses or departments. Here we can take example of, let's say, so-called preclinical and clinical, or we can say between anatomy, physiology, and biochemistry, or between pediatrics and ONG. So it's to interrelate and unify subjects frequently taught in separate academic courses or departments. The teaching of different subject areas in a thematic manner so that the different disciplines are not emphasized. In this approach, the teaching, or in other words, like we were saying, the timetable is organized under themes. So the emphasis is on the topic rather than on the disciplines. And this would be clear when we go further about this topic and discuss. You'll see that how the emphasis is on the topic or on the condition rather than on the disciplines contributing to that particular topic. Here is another approach. The definition of integrated clinical education adopted by the American Council of Academic Physical Therapy in October 2017. ICE is a curriculum design model. A curriculum design model where clinical education experiences are purposely organized within a curriculum. Now, if we look at this definition, and if we are talking about a medical school, let's say in our clinical years, we are already having clinical experiences, and they are organized within a curriculum. But when we talk about integrated clinical education, we are not talking about only the clinical years, but also the so-called preclinical years. In physical therapist education, these experiences are obtained through the exploration of authentic physical therapist roles, responsibilities, and values. This means that if we want to have an integrated clinical education, for example, in physical therapist education, we would look at the roles and responsibilities and values of a trained physical therapist. And then that would become our goal to achieve. And the whole curriculum would be directed to achieve those roles, responsibilities, or values. And this is what is called the top-down approach, that first we identify what are our goals, what are our attributes, what do we expect from our graduate to do and perform, and what capabilities he or she should have at the time of graduation. And that makes the basis of our curriculum, and that helps in integrated clinical education. ICE refers to a teaching approach that combines basic and clinical sciences to improve or to provide a comprehensive learning experiences for students. So combination of so-called basic sciences and clinical sciences. This method aims to break down barriers between different disciplines, promoting the retention of knowledge and acquisition of skills through continuous and progressive development of concepts and their applications. Means that in integrated clinical education, the theory and clinical experience or clinical procedures go hand in hand, so the knowledge and skills are obtained at the same time, and this helps in retention of knowledge and acquisition of relevant skills. In this model, students are exposed to real-world clinical settings early in their education. That is what we call is the early clinical exposure. If we talk about medical schools, or maybe in the, for example, in dentistry, that students start their clinical training from day one of in the medical school or dental school. So we later on I'll show that how it is done, but it is traditionally we see that the clinical education comes after the phase 1 or in phase 2, but in integrated clinical education, that becomes part of student training from the very early period in medical school. This integration helps in developing a holistic understanding of patient care. So it is claimed and proved that having this early clinical exposure from the very beginning in the training helps in developing a physician or a surgeon who can give a better care to the patient, including physical, emotional, and social aspects. Now, another aspect of ICE is interprofessional education. So the integration can be intraprofessional or interprofessional. Intraprofessional means within, for example, a dentistry course or within a pharmacy course or within a medical course, whereas interprofessional means between different professions like today we will be talking more about, let's say, medicine, dentistry, and pharmacy. So the integrated clinical education can be within one course or can be in between different courses. And here we, on this slide, we are talking about interprofessional education. So the developed in Northern Ontario, Canada, the integrated clinical learning involves a team of clinical teachers from a range of health professions teaching a team of students and trainees together in common community and clinical settings. Means a team of clinical teachers from a range of different professions. So these healthcare providers, for example, coming from dentistry, pharmacy, and medicine, the three different professions. And then the students are also from all these three disciplines, and they are taught together by this team of teachers. So this is interprofessional education, where the teachers are coming from different professions, although all related to healthcare fields, and teaching the students also coming from different schools and either working in the community or in clinical settings. Means that the course is arranged in such a way that it can help the different disciplines, and it is taught by the specialists from different disciplines to the students who are working in that environment. So this is interprofessional education, and here the integration is between different professions. In this case, the healthcare providing professions. Integrated clinical education is the balanced integration of educational strategies to develop healthcare providers and team-based competencies focused on improving the quality of care. So interprofessional education actually addresses and prepares teams from different professions who can go into the community or in the clinical settings and work together for better care of the patients. Obviously, if there are different professions involved, so the learning outcomes have to come from all the different disciplines involved. If we are taking the example of medicine, dentistry, and pharmacy today, so the learning outcomes should address the needs of all these three disciplines. And so this means that the teams from all three disciplines need to sit down and identify the learning goals which satisfy the needs of medical students, dental students, and pharmacy students. And this should be in relation to the needs of the community or needs of the patient. So this is really the concept of interprofessional education. In other words, the teachers and the students coming from different disciplines, sitting together, working together, understanding each other, learning from each other, and at the end of the day, providing a better care to the patient. This is the definition of integrated clinical education. I copied from ChatGPT. So ICE refers to an approach in health care education that combines theoretical learning with practical hands-on experience in clinical settings. And that's what we have been talking in the previous slides. This method aims to bridge the gap between classroom instruction and real-world practice, because when we introduce the early clinical exposure, there would not be a gap between the theory and the clinical practice, and the learning would be together. So integrated clinical education can really bridge the gap between classroom instruction and real-world practice. So that is up to now is the concept of integrated clinical education, which this integration can be within one profession, like let's say within dentistry, or within different professions, let's say between dentistry and medicine, or dentistry and pharmacy. So that is the concept or the explanation. Is there any question or comment by anyone? Please don't wait till the end. You can stop me at any time when you have any question or any query and you want to discuss that. Is there any question or comment up to now in understanding the concept of? Yes, please, Dr. Ong. Yes.
Thank you, sir. Thank you, sir. No questions, sir.
Right. Okay. All right. Now, let's go to the next step in this. And this is the statement by General Medical Council of the UK. And it says that we strongly favor true integration of the course with horizontal and vertical, using the term in the sense of interdisciplinary synthesis and not simply coordination or synchronization of departmentally based components. So in this statement, there are a number of terms used which relate to the concept of integrated clinical education, and we will try to understand it. So here is the first term they are using, horizontal and vertical, and then is the coordination and synchronization. See, the horizontal integration means that information taught in the same curricular phase is taught together, usually focused around a theme or a problem. Example is, for example, in medical schools, we have phase 1, or so-called preclinical teaching, where we have anatomy, physiology, and biochemistry. So horizontal integration would mean that there is integration between these basic science subjects. Or it can be between the basic science subjects, or can be between the clinical or phase 2 subjects. Whereas vertical integration means that information taught in different curricular phases is taught together. Can you mute yourself, please? Right. So vertical integration means that information is taught in different curricular phases and is taught together, usually focused around a clinical themes. This means that both basic sciences and clinical sciences are taught together. If you look at this diagram here, so the horizontal integration is either between basic sciences or between clinical sciences, whereas vertical integration is both between basic sciences and clinical sciences. In this diagram, you can see the clinical teaching starts from the very beginning, although it's just a small component here, and it would increase with time. Similarly, the basic sciences, although a major component in the beginning, but it keeps on being taught even in the clinical years. So none of them is zero. So clinical teaching starts early and then takes later on bigger chunk, whereas basic sciences take a bigger chunk in the beginning, but continue to be taught even up to the final year or the last part of the training. So this is the concept of horizontal integration and vertical integration, and the ideal would be both horizontal and vertical integration if we want to achieve or get the real benefits of integration. So there are 5 principles of integration. The first one The integration focuses on key issues, means that the emphasis is on important areas, and it is focuses on key issues as it promotes learning in context. When we were talking about early clinical exposure, means when we are teaching anatomy, physiology, or biochemistry, we are relating our teaching to clinical scenarios, clinical context. So it is the promotion of learning in a relevant context. Second, it adopts holistic approach, means covers all aspect of an issue in one go. Traditionally, we teach the normal first and then the abnormal, or physiology in preclinical and pathology later. But in integrated curriculum, both go by side. So you learn normal at the same time you uh, learn the abnormality, and then you can compare the normal with the abnormal, and that helps in better understanding and retention of knowledge. It focuses around core curriculum, must know knowledge. So integration mainly addresses the most important areas, and it does not address the trivial or minor prints, but focus is on more core curriculum or must know knowledge. The second principle is that integration enhances construction of knowledge through integration of basic and clinical sciences, which is vertical integration, deep learning and understanding of new concepts. The traditional teaching is like more superficial learning, but with integration, the learning becomes deep because we are learning in the context, and our comprehension and concepts becomes more clear. Identification of gaps in knowledge and search for answers, use of resources. Problem-based learning sessions is one example where students identify the gaps in their knowledge, and based on those gaps, they search for the answers. So it is a focused type of learning where they use different resources and try to fill in those gaps. So means that the learning is in the context and in relevance. Application of newly acquired knowledge to solve problems, like for example, in case-based learning and team-based learning. So that is another really important aspect of integration, that you learn something and you apply it immediately. So that really helps in understanding of the concept and the retention of knowledge and skills. The third principle is that integration promotes application of knowledge to real life situations by learning through problems. We were just now talking about problem-based learning or case-based learning, using knowledge gained to solve new problems or new situations. So the students learn new information, and then they apply it in novel or different situations, which is real life situations. Again, it helps in understanding and retention of information. Getting feedback and improving the learning, that's another important aspect of integrated curriculum, where the student feedback helps to improve the teaching learning activities. The fourth principle is that it fosters critical thinking and lifelong learning skills through generating hypotheses. As you know, when we are conducting problem-based learning sessions based on the information, students are supposed to generate hypotheses, and that fosters critical thinking. And interpreting data, for example, in case-based learning, searching evidence of the searching of information, like in problem-based learning sessions, and making decisions and finding relationships and identifying differences. So the critical thinking is taught through a number of approaches in integrated clinical education. And the fifth principle enforces staff development. Of course, when we are trying to adopt the new approach, it improves our teaching skills. We master new techniques, and we learn how to give a constructive feedback and enhance evidence-based teaching, keep high standards, and achieving excellence in areas of expertise, because we need to apply all these skills in this integrated curriculum. So these are the 5 principles of integrated clinical education. So goal of integrated clinical education is to produce well-rounded healthcare professionals who are prepared to meet the challenges of modern clinical practice with confidence and competence. They are well-rounded because the different aspects are taken care of at the same time. And the other important area here is that the skill of lifelong learning is imbued, and the students really follow this. And once you have this lifelong learning skill, then you can meet all the challenges in the future, although they may not be known at the present time. But with this skill of ability of lifelong learning, we can learn new skills and meet new challenges. And that is the main goal of integrated clinical education. Right. Now, we were talking about different levels of integration, and the definition I showed you of General Medical Council also mentioned about a level of integration. So we will go through these levels of integration, as I believe that it would help us to really understand and implement integrated clinical education. So there are 11 levels of integration. In the SPICES model for educational strategies, this is the concept which was introduced by Harden in 1984, that the integration is a continuum. It is not a static kind of thing. It's not all or none law. It is a continuation or continuum of improving, with full integration at one end and discipline-based or subject-based teaching on the other. So let's say the traditional curriculum is subject-based or discipline-based. So that is one end. The other end is a fully integrated curriculum. And in between, there are number of levels. So if, let's say, level 1 is subject-based, and then full integration is 11, number 11. So there are 10 levels in between. So it is a continuum. So once we start implementing the integration, we can move on from one level to another along the way, based on our ability and the resources. Here are those 11 levels. The first level is isolation. Second is awareness. Third, harmonization. Fourth, nesting. Fifth is temporal coordination. Sixth is sharing. 7 is correlation. 10 is complementary, multidisciplinary, interdisciplinary, and transdisciplinary. And we will go through definition, not really very details, but trying to understand these levels of integration. So in the first 4 steps of this ladder, the ladder of integration or continuum of integration, in the first 4 steps, the emphasis is on subject or discipline based, which is mainly our traditional curriculum. The following 6 steps emphasize integration across several subjects or disciplines. And final step, which is number 11, the student takes more responsibility for the integration, and they are given tools to do so they can integrate different areas themselves. So first level is isolation or fragmentation or anarchy or no consultation with others. For example, students attend a lecture in anatomy and then move on to a lecture in physiology with neither lecturer being aware of what was covered in the other lecture. I think this is the uh, level which at least I was trained as a medical student, that the let's say lecturer in anatomy doesn't know what is being taught in physiology, and the physiology lecturer doesn't know what is being taught in anatomy. Department or subject specialists organize their teaching without consideration of other subjects or disciplines. So they do not have any discussion or link or understanding with others. So each department or each subjects organize their teaching at their own without knowing what is being taught by other. For example, anatomy may be teaching musculoskeletal system, physiology teaching cardiovascular system, and biochemistry may be teaching the renal system. So it is totally in isolation from each other, totally fragmented, and no consultation with others. Each discipline looks at the curriculum content in terms of areas to be covered, depth of coverage, sequence, and timing from the perspective of their own discipline. So what area is to be taught, how much is to be taught, what is the sequence? It's every discipline decides at their own, and they are completely independent in that. No attention is paid to other related subjects or disciplines which contribute to the curriculum. The relationship between subjects is not explicitly covered, and related topics from two disciplines are not intentionally correlated. So completely fragmentation, completely in isolation. And each subject is seen as an entity itself, and the objectives are seen as mastery of the subject. Like anatomists want to make students anatomist, and let's say a pediatrician wants to make the students a pediatrician. So every subject or every discipline tries to make the students really master in their own subject, and not what is the really aim of the course itself. So that is level 1, and then from level 1 to level 4 is some more or less different levels of isolation. And then let's go on straight to level 5, and which is temporal coordination, parallel teaching, or concurrent teaching. Now is that each subject remains responsible for its own teaching program. However, the timing of teaching of topics within the discipline is done in consultation with other disciplines. So previously, there was no consultation, no coordination at all. But by level 5, there is some coordination between the different disciplines. And when they are preparing timetable, they prepare a coordinated timetable so that the timing of teaching of topics within the discipline is done in consultation with other disciplines. The timetable is adjusted so that the topics within the subject or disciplines which are related are scheduled at the same time. Similar topics are taught on the same day or in the same week. For example, physiologists teach the functions of the heart, and at the same time, anatomists teach the structure of the heart. So that's how your modular system comes in, the coordinated timetable. So now, rather than teaching the fragmented and every discipline teaching, so emphasis previously is on anatomy, on physiology, on biochemistry, but now here there is some coordination, and we are talking about a module for, in this case, here example of cardiovascular module. So all the disciplines, anatomy, biochemistry, physiology, or others, they are all teaching the same system at the same time. So there is a coordinated timetable. So this is a parallel teaching or a concurrent teaching. So here there is some degree of coordination where the topics are related to the same system. Students study the concept of different subjects separately and are left themselves to uncover the relationship. So still it is subject-based. Anatomy is teaching from anatomy point of view and physiology from physiology point of view, all, but they are teaching the same system, and the students have to see or link whatever they are taught in anatomy with what is taught in physiology and biochemistry. So they, for example, they are talking about structure of the heart and the functions of the heart. So students have to link these two concepts together themselves. The next level, which is level 6, is sharing or joint teaching. So they move on from subject-based to have some kind of joint sessions. So two disciplines may agree to plan and jointly implement a teaching program or a joint session. So overlapping concepts of ideas make the basis for shared planning and teaching, and students are shown the relationship between the two disciplines. If we see previously up to level 5, students are left themselves to uncover the relationship. But when we come to level 6, because there are joint sessions, so students are shown the relationship between the two disciplines. They are guided to link the two disciplines together or integrate the two disciplines together. Joint session, for example, between pediatrics and obstetrics, let's say infant of diabetic mother, obstructed labor and birth asphyxia. So there is a joint session conducted where they talk about pregnancy, where mother is diabetic and the baby is born and there is an obstructed labor and birth asphyxia. So obstetrics would be talking about the situation or the problems or issues in the mother, and whereas pediatrics would be talking about the problems to the baby. So there is a joint session, and there so students are shown the link between the two situations. And the other example is that community child health teaching program run by Department of Child Health and Department of General Practice, and they both, in that situation, having joint sessions and teaching the students together. And this is the level 6 of integration or sharing. Another example of parasitology and pharmacology run a joint session on malarial parasites and anti-malarial drugs. So the parasitologists talk about the life cycle of malarial parasite, and pharmacologists talk about the different drugs working on different levels of life cycle of malarial parasites. So this is a special joint teaching, and students are shown the link or integration between two disciplines. Level 7 is correlation, a commitment program or democratic program. And here, although it's subject-based, but there are, apart from sessions, the joint sessions, it moves to having more of, for example, having common assignments, and also introducing problem-based learning sessions, for example. So means that the joint sessions and joint assessments and joint activities are playing more role than the level 6. The emphasis remains on discipline, though, or the subjects. But within this framework, an integrated teaching session or course is introduced in addition to subject-based teaching, like a hybrid curriculum, where we have, let's say, the a lecture-based curriculum. At the same time, we have problem-based learning sessions and some joint sessions. So that becomes a kind of concomitant program or correlation. One example of this concomitant program is multidisciplinary seminars or symposium, where different disciplines, there's one topic and different disciplines come together and talk about it and conduct a symposium on that. The next is that the assignments are given to the students, and they are designed in such a way that the different disciplines need to be included at the same time. And of course, problem-based learning sessions are a good example where the students may identify the learning needs which are relevant to different disciplines. For example, they may be related to physiology, anatomy, biochemistry, or pathology, or pharmacology. So one PBL session can integrate different disciplines based on the learning outcomes and needs identified by the students. The next level is the complementary level. There are mixed program and both subject-based and integration. So at this level, the integrated session represents a major feature of the curriculum. So subject-based is much less, and the integrated sessions become the major component of the curriculum. And focus for teaching is maybe by a theme or a topic to which the discipline can contribute. Now, this is important component here, the theme, because now the teaching is organized under different themes, which may be clinical skills or clinical conditions or signs or symptoms. I'll show you an example, and this is the complementary program or mixed program. It's still there is subject-based, but major component is integrated. How to develop a theme of the week? Here is an example. Let's say we are talking about hemopoietic or hematology and lymphoid module. And we know that the major disciplines involved would be the physiology, basic biochemistry, pathology, and pharmacology. And to each discipline, we ask them that what are the 3 topics which you want to teach in the beginning, or let's say the first week of the module. What would be the 3 topics you would like to teach? So we get the list from the physiology, from the biochemistry, from the pathology, and the pharmacology. And now we find out that the major, for example, physiology want to teach hemopoiesis, biochemistry want to teach structure of hemoglobin, pathology want to teach the anemia, and pharmacology want to teach iron therapy. Now, because this is a modular system and the module is here is hemopoietic, hematology, and lymphoid. So each discipline has to identify the topics related to that module. And if we get this list and we look at this, the anatomy, the physiology, hemopoiesis, biochemistry, structure of hemoglobin, and the pathology anemia and pharmacology iron therapy. So naturally, if you think the theme comes out to be as anemia. So if the theme of the week is anemia, so each discipline would focus towards that theme, and so they would be teaching accordingly. So we can adjust little bit some topics up and down, but in this way we can come to a theme. Now here is, let's say, the timetable of a theme. So theme is anemia, and now there are different, you see, the disciplines contributing to the same theme. For example, here is the biochemistry. There's normal hemoglobin, then physiology teaching hemopoiesis, the pharmacology teaching iron therapy. So in this way, there is a module of hemopoietic and lymphoid system. This is the first week, and the theme of the week is anemia, and each discipline is teaching to relate in relation to the theme of the week, and in this way, this would be an integration. This would be an horizontal integration, but if we bring in the clinical areas together, for example, some let's say physician giving a session on clinical features of anemia, so that would become both horizontal and vertical integration. So this is a clear example of theme-based learning in a modular system, and that makes our the integration at the level 8. Right. Now, this is most of the medical schools are around that level in Malaysia. What is happening here is not only the teaching, but the examination reflects the emphasis on both integration and subject or discipline. So the assessment would include modified essay question or structured essay questions, or problem-based questions, or extended matching questions. So all these questions integrate different disciplines within them. And also assessment is carried out during small group sessions like problem-based learning sessions, and joint sessions means joint questions like extended matching questions. Next is the level 9, which is multidisciplinary or webbed or contributory. And a multidisciplinary approach brings together a number of subject area in a single course with themes, problems, topics, or issues as the focus of students. So this means that the major areas are all covered together like a single course under themes, under modules. Courses are developed around body systems such as cardiovascular system or gastrointestinal system, CNS system. And imagine if we can continue the same body systems in clinical years. For example, we have this cardiovascular module in the so-called preclinical years. And in clinical years, we also have a cardiovascular module where all the discipline like medicine, pediatrics, surgery, everybody is teaching about CVS. So this means that the postings or rotations would be based on the body systems and not on the specialties. So there will not be a medical posting or surgical or pediatric posting, but posting would be, for example, CNS, and medicine would be teaching in relation to CNS, and pediatric would also be teaching in relation to CNS, and similarly surgery would be teaching. And so that is where the multidisciplinary are contributory. So organizing the course around body systems is one, and another approach is that the stages of life cycle can make the basis of the curriculum. For example, based on the birth, childhood, adolescence, adulthood, and elderly and death. So all the topics are taught under these modules or these approaches. So this is the multidisciplinary approach. Themes may be combination of information and skills which are relevant to medicine, such as tasks, ethics, or health promotion. Now, the last level or the highest level of integration is transdisciplinary, which is also labeled as fusion, immersion, authentic. Here, the curriculum transcends the individual discipline. So there's not emphasis on the discipline, but on the overall approach as well. The curriculum in first 3 years of students' studies is integrated around body systems like CVS, CNS. And in the last 2 years, students are attached for periods of time to range of specialties in hospital and community and experience the various contexts in which medicine is practiced. So let's say in last 2 years, students don't have these postings of medicine, surgery, or pediatrics, but they are learned based on the themes. Here is another example where in Dundee, a set of 113 clinical problems or tasks are provided the students with a framework for integrated their experiences. So after spending first 3 years under different modules, the last 2 years are based on the problems or tasks. And students look at each of these tasks from the perspective of different attachment. A task, for example, abdominal pain, students have an actual surgical perspective in surgical attachment and different perspective in medical, gynecological, and general practice attachment. So there is a task is abdominal pain, and student would learn about different areas under it in different disciplines. So a printed or electronic study guide is a key element in helping students with the challenge of integrating these different experiences. So obviously, if we want to implement that, we need to provide the relevant facilities. But as I see, so far, for example, in Malaysia, we are at level 8 or 9 of the integration. And most of us are quite happy and satisfied with that level of integration. So here is another example, integrated clerkship in ambulatory care setting of South Dakota. The students spend their whole year 3 attached to clinics staffed by physicians from various specialties. Here in Malaysia, in UNIMAS, the students spend the whole year, year 4 in the community, in the clinics in the community, whereas specialists from the faculty would go and visit. For example, they are in a peripheral clinic, and 1 day a week, a pediatrician is going there, and the next day maybe a medicine, and next day obstetric and gynecologist and surgery. So students spend the whole year in the community clinics, and they are attending the clinics from different specialties. So they are not under different postings. They are in the community attending the clinics, but the specialists are coming from different disciplines on the different days. So this is an example in Malaysia as well. And the other is this, as I quoted, that there are multidisciplinary clinics, and the students achieve the course objectives at their own speed with their own method. the student is driven to find out and is dictated by the prescribed tasks. So these are different levels of integration, and I feel that it's important to have the concept of this. And so if we understand this, we can assess our own curriculum in our own institutions and see that what level of integration we have and how we can improve on that, what steps we can take to upgrade the level of integration in our own institution. Right. Any question or comment by anybody at this stage before we move on to the next level? Is there any comment or question by anybody? Or
Now, can you just explain a little bit about that level 9 and 10, that is the multidisciplinary, interdisciplinary, that part? Sometimes you can see a bit confusing to, yeah.
Okay, here between 9 and 10.
9 and 10.
Okay.
Yeah, this is 9 multidisciplinary, then
Yeah,
10 is
so
interdisciplinary. You are not so near.
Let's say here, let's say we have a session on malaria. And now malaria is being taught in parasitology, in treatment in pharmacology, then also taught in medicine, in pediatrics and ONG. So it is being taught in so many different disciplines. So here what we do is that we have one session on malaria, and all these disciplines, they would come and have a session, and everybody would teach according to their own specialty in that single session. So this would be a single course, and the theme is malaria. The one thing is that here in these sessions, there would be the breadth of the topic, not so much of depth of the topic.
Okay.
That means that although we are teaching this in one session, that does not mean that different disciplines would not teach in their own discipline as well. For example, pediatric is teaching here as well, but during the posting, when they have a bedside teaching a case of malaria, they would be teaching there as well. So breadth is covered in this session and depth may be covered during the posting itself. So this is a multidisciplinary approach, right? And then coming to the transdisciplinary means that...
Trans is understood, but I want in between that 9, 10 is the interdisciplinary.
Okay. Oh, number 10.
Number 10, yeah.
Yeah, which I have not mentioned here.
Yeah.
Interdisciplinary is that in between two or more disciplines. Between two or more disciplines, the course is like, you can take the example of interprofessional, for example.
Yeah.
So that would be the level in 10.
Yeah, that means the boundaries of each discipline is further blurred.
Right? No, it's actually because this is a slow progression.
Yeah.
From one end to another, there would be a lot of overlap.
Yeah.
We cannot be so bounded.
Yes.
That between 9, let's say 8 and 9 and 10, there would be some degree of overlap, of course, because this is a continuum.
Yeah.
So that's how it goes.
Thank you very much.
Right. Okay. Right. Now, having...
Can I ask one question, please?
Sure, please.
It's again regarding the level 10.
Yeah.
Can I say that currently in our college, we are practicing like, I am from pharmacy, College of Pharmacy.
Right.
So I go and teach, I'm teaching currently clinical pharmacy, therapeutics, the integrated pharmacology and so on, clinical pharmacology.
Right.
So sometimes I will go to College of Medicine, for example, and give some teaching there. Sometimes nurses will come to pharmacy. Is that what you mean by level 10?
Yes, because now but when you are going and teaching medicine, they are only medical students.
Uh, okay, in the current university that I'm working in, yes.
Yeah.
But previously, I
So-
used to work in another university where we combine all pharmacy students with nursing students with,
Yeah, that's what it
of course,
is.
not the whole course, just
No,
certain.
yeah. The second example is STEM. Second example, when the students from different disciplines, let's say you are having pharmacy students as well as medical students and maybe nursing students in one session. And
But
you,
this can be applied in the clinical years, right? Or
we,
doesn't matter?
no, for in our case, for example, pharmacology is start before the clinical years. So
Mm, mm.
so so this means there would be a vertical integration that both clinical and preclinical areas are being taught.
But this is the idea. I mean, this is called level 10, right? When
Yes,
at
that's right.
different like colleges
That's right.
are.
Yeah,
Thank you.
the example you give for your second institution is level 10.
Level 10.
Yeah,
Thank you very much.
right. Okay, thanks. Okay, now having understood that, and as I said, the main purpose of understanding these levels of integration is to assess the level of integration in our own institution and see how we can move on to the next level. Now, there are some key components of integrated clinical education, means that these components must be there if we want to say that we have integrated clinical education. The first one is early and continuous clinical exposure. As I mentioned earlier as well, that in integrated curriculum, if we are talking about MBBS program or medicine program, the clinical exposure is from the very beginning. Students are introduced to clinical environment early in their education and continue to gain exposure throughout their training, and this helps them apply theoretical knowledge in real world setting. Example is that let's say in one of medical school where I was working, let's say we have a CVS module, and usually in the last week of CVS module, we would bring the students to the hospital and show them the cases are related to cardiovascular um, system. For example, now they can see what cyanosis looks like. They can count the pulse rate. They can take the BP. So they really see in a clinical setting what they are taught. Let's say they don't have to imagine what cyanosis looks like. They look at it, right? So this is early clinical exposure. Some medical schools who cannot, let's say, bring the students to the hospital, they use their clinical skill labs, the mannequins and all those things, to give at least some exposure, clinical exposure to the students early in their training. So early clinical exposure is one key component of integrated clinical education. Second is interprofessional education. Often involves learning alongside students from various health disciplines. For example, today, if we are talking about medicine, dentistry, and pharmacy, for example. So the if we combine these students and we teach together, uh, not necessarily the whole course, but some sessions, so that would be interprofessional education, and it would show the integration of education in different disciplines. Right. The next is the competency-based education. Very important. In this concept, the student, the emphasis is not on the time, but emphasis is on achieving the task, achieving the learning. So in this case, for example, the MBBS course may not necessarily be 5 years for everybody. If a student can achieve all the outcomes in, let's say, 4.5 years, they can graduate based on that. Some students may take more than 5 years. So the criteria is obtaining or achieving the outcomes rather than based on the number of hours or number of years. And students are assessed on their ability to perform tasks and make clinical decisions. Simulation-based learning, clinical skill labs, simulation exercises using mannequins, virtual reality, or standardized patients are used to mimic real life scenarios. This is actually preparing the students before they go to real world or real clinical situation, so they can practice in these clinical skill labs. And by the time they go and see the patients in the real situation, they have pretty good idea that what they are expected to do and how to do that. Mentorship and feedback is very important component. The experienced clinicians mentor students, provide guidance and feedback on their performance. This helps students learn from real cases. So basically, feedback would tell students which are the areas they need to work more on that, and it would help them to improve their areas of weakness. Reflective practice, very, very useful. Students are encouraged to reflect on their experiences, analyze their performance, and identify areas for improvement. So one is that feedback helps them to identify the areas of improvement, and reflective means that they themselves are self-assessment and they find out that which are the areas they need to work more. And this is a component of what we call is student-centered learning. Integration of theory and practice. The curriculum is designed to integrate theoretical knowledge with clinical practice. For example, lessons on anatomy or pharmacology are closely linked with the clinical relation. So when even we are teaching the basic sciences, we always relate it to the clinical scenarios or clinical situations. So how to deliver the integrated curriculum? The delivery of integrated curriculum, here are the joint sessions, which I have mentioned earlier. Then we have problem-based learning sessions. We have case-based learning sessions. We have curriculum designed under themes. I have shown you the example of anemia and this hemopoietic module. Early clinical exposure, assignments, multidisciplinary or interdisciplinary assignments. The assignments are given to the students which need them to work in different disciplines rather than just one subject. They can have projects which involve multiple disciplines, or they may be asked to prepare some videos which involve different disciplines. And then vertical modules are like personal and professional development and ethics. These would be the module which run vertically from year 1 to year 5 in medical school, for example. Now, I'll give you one example of case-based learning. This is continuation of what we were doing the last few days in our group discussion, where I was requesting you to work on some case scenarios. And here is one example. Hopefully it would help. So integrated case-based learning sessions are a great way to enhance collaboration and understanding among different healthcare disciplines. So integrated case-based learning. So this would be example of of this ICBM. Integrated case-based learning session involving medicine, dentistry, and pharmacy. So this example involves these three disciplines. The title is in this example is managing a diabetic patient with periodontal disease and polypharmacy. And the overarching learning outcomes would be the participants would develop interdisciplinary collaboration and understanding in managing a complex patient with diabetes mellitus, periodontal disease, and multiple medications. The second overarching learning outcome would be that participants will gain a deeper understanding of how their respective fields contribute to the holistic management of patient. I think this would be clear when we really go through the example that how these overarching outcomes would be achieved. Now, here is the case summary. A 60-year-old male patient with a 15-year history of type 2 diabetes mellitus presents with worsening periodontitis. The patient is on multiple medications, including metformin, insulin, antihypertensives, and a statin. And the patient complains of bleeding gums, difficulty in chewing, and recent episodes of hypoglycemia. So this patient who is a diabetic and is having also medications for hypertension and a statin, and he presents to, let's say, a dental clinic with bleeding gums and difficulty in chewing, and there also tells that he has some episodes of hypoglycemia, means there may be some problems with medication. So based on this, the learning outcomes now here, because we are talking about medicine, about dentistry, and about the pharmacy. So we have to identify the learning outcomes for all the three cohorts. So for medicine, discuss the systemic implication of poorly controlled diabetes and its impact on oral health. Explain the importance of glycemic control in managing periodontal disease, because this patient also had hypoglycemia. And review the management of diabetes in the context of potential drug interactions and adverse effects. So this would be the learning outcomes for medical students. The learning outcomes for dentistry students explain the bidirectional relationship between diabetes and periodontal disease. They identify appropriate dental interventions and treatment planning for a diabetic patient, and discuss the impact of oral health on systemic conditions like diabetes. Then the learning outcomes for pharmacy: review the patient's current medications, potential drug interactions, and adverse effects. Assess the patient's medication adherence and potential barriers. Provide recommendations for managing polypharmacy in the context of diabetes and periodontal disease. So based on the scenario, we have identified learning outcomes for all the three relevant cohorts of students. Now that is the content. Now how to conduct this session, the structure of the session. So there may be a 10-minute introductory session where the facilitator gives the overview of the case and the presentation of patient's history, current symptoms, and medication list. Then students go in their groups: medicine group, dentistry group, and pharmacy group. And medicine students, they discuss the patient's diabetes management, focus on glycemic control, complications, and potential impact on oral health. Dentistry students review the clinical findings related to periodontal disease, discuss possible dental intervention, and explore the impact of diabetes on oral health. And pharmacy students evaluate the patient's medication regimen and consider potential drug interaction and discuss strategies to improve the medication adherence. So So this is 40 minutes that these students would discuss among their groups. Then they come back, and then all the three groups are sitting together. So first is that each subgroup presents their finding and recommendations. So then the whole group discusses the interplay between systemic health, oral health, and medication management. And the whole group develops a comprehensive interdisciplinary care plan for the patient. So this would be so at the end of the day, there would be a comprehensive interdisciplinary care plan for the patient, where there would be contribution for medicine, from dentistry, and from pharmacy. And once it is done, then there is another 10-minute session by the facilitator who would summarize the key learning points, highlight the importance of interdisciplinary collaboration in patient care, and addresses any remaining questions or concerns. So this can be nearly a 2-hour session, which is in a way interprofessional session, and there is integrated clinical education being implemented. So that is one example where a case-based learning can integrate these areas. Assessment, I would just give the list. We are not going into the detail of that. Theory can be assessed by a modified essay questions or patient management problems, problem-based questions, structured essay questions, extended matching questions, and assignments or assessment during PBL. There may be portfolio as well. Clinical assessment may be based on the logbooks and portfolios, OSCE and mini CX, long case and short case, etc. So in this, because these methods of assessment can cover the integrated areas, so they would be appropriate for these steps. I think that completes my presentation. And before we go on to the hands-on activity, if there are any questions, I will be happy to answer that.
One question here, Dr.
Yes,
Ong.
yes, please. Yeah.
The example just explained recently is it is combination of ICE and MPE, is it?
I see. And
Interprofession, integrated and interprofessional also, no?
yeah,
Correct? Is it correct?
as I said, the integrated clinical education can be within one specialty, when one course, for example, MBBS or dentistry or pharmacy. This means that the subjects taught within that course, there could be integration, both vertical and horizontal, or it can be between different professions.
Oh, okay, sir.
So there is interprofessional and intraprofessional integration. So it can be both ways.
Okay. Thank
Right.
you, sir.
Any other question? If none, so now we have, let's say, 3:50. So can we have a hands-on session for next, let's say, 25 minutes, means up to 5:15. And then we would come back and meet again and discuss about that. Now, hands-on activities. So can or should I send it by WhatsApp, or you can copy? I think I'll send by WhatsApp. So this would be the task for room 1. This would be task for room 2, and this would be the task for room 3. So for room 1 is develop a case scenario for an interprofessional session, for example, the problem-based learning session involving medical, dental, and pharmacy students. But you have to identify the learning outcomes for students of each discipline. So a case scenario with learning outcomes. Task 2 would be draw a 1-week timetable for interprofessional sessions, let's say either on diabetes, let's say it's a session or the interprofessional session on diabetes involving medical, dental, and pharmacy students. This means that you have to identify the topics and put it in the timetable in appropriate sequence. And for 3, design a structure for conduct of an interprofessional session. You can choose rheumatoid arthritis or hemophilia. Hemophilia, for example, would involve both medicine, dentistry, and pharmacy students, and then identify the outcomes for students of each discipline. So now let me divide you into the 3 groups, and then I will send all these 3 tasks in the WhatsApp group as well. You might have noted yourself as well.
Yes, it is.
Can you see now, sir?
Oh,
Come-
yes,
yeah.
yes. can
Actually,
see.
I was
Great.
coloring, but since the
Yes,
time.
yes, no problem.
Can see, yes, yes.
So we have the topic was diabetes, and we have to the 5 days, Monday, Tuesday, Wednesday, Thursday, Friday in 1 week.
All right,
And we have made first written down the topics. So the
Right.
first 4, the blue, the gray color topics are the one which I've listed before below. In my group were Dr. Abby from dentistry and Dr. Girish from biochemistry.
right,
So I am from ophthalmology. So
Right.
then the first 4 topics were basic sciences. So definition, classification, lab diagnosis, then insulin and glucagon regulation of blood sugar and metabolic disturbances.
right.
Then we have pharmacy topics, oral hypoglycemic drugs and type of insulin. We don't have much knowledge more what they teach.
No, it's all right. We
Then,
need the concept only. Yeah.
Then we went to medicine, the medical clinical part, that is diabetic foot, diabetic nephropathy, retinopathy, gestational diabetes. And the first lecture would be in medicine about diabetic symptoms. So that we decided to put as a case based. So you can see on Wednesday, it is a CBD.
All right.
Because,
Okay.
because that is how clear, otherwise it was overlapping with our investigations taught by preclinicals.
All
So we
right.
thought something different to put.
All
And then in dentistry, it was oral manifestation of diabetes and dental treatment consideration in a patient with diabetes.
right.
So in the first 2 days, we covered the preclinicals, that is the basics, insulin, glucagon, metabolic, definition, classification, and live diagnosis. Then we started with clinicals. So in the first day of the clinical, we put a case for symptoms and all that. And then on the afternoon, it was pharmacological oral hypoglycemic. Morning, again, it was pharma lecture. Afternoon, it was a oral lecture. Then Friday morning, it was clinical foot and retinopathy. Afternoon, it was dental lecture. And then we have 2 lectures of 2 to 4 also. That is diabetic nephropathy and gestational diabetes.
Right.
In between, you generally have a break. So these are pre-morning 8 to 10. This is 12 to 2. This
Right.
is 2 to 4.
Right. Any comments from the other participants? Anybody want to comment on that? Yeah, as long as the concept, I think that clearly tells that we are integrating different disciplines here. It's even showing the vertical integration where the clinical sign symptoms are the clinical, and then even the diabetic nephropathy and gestational diabetes. So means that you are bringing ONG here, you are bringing ophthalmology here, diabetic foot may also include surgery here, and maybe another topic you can include is glucose metabolism from biochemistry as well.
Yeah, that was metabolic disturbances in DM.
All right, yeah, it's there. So basically, yes, the concept is that we have the week theme is diabetes. And under that, we have identified the topics, physiology and biochemistry and the clinical areas. You may have, let's say, anatomy topic on it's the pancreas, for example. And so In that way, we are having both horizontal and vertical integration. I think the concept is very clearly defined here. Well done, this group.
Thank you, sir.
Good, good. Who is the next? Is room 3 ready?
Room 1 actually, he's not, Yaman not able to join. Maybe you will have to allow him.
But,
Because as I got the message
but
from,
there's no restriction. There's no
there is no restriction, yeah.
There's no restriction. Oh, I can see Dr. Yaman now.
Yeah, Yaman is there, yeah.
Yeah, he has joined. So is room 1 ready to present, or we go to room 3 first?
Can go to room, because he's not talking, then we can go to room 3 first.
Okay, the room 3.
Who is the presenter from room 3? Renu, Lakshmi, Kalyani, and Maitha.
Dr. Lakshmi.
Okay.
Okay, please go ahead.
Room 3, I'll just share the slides.
Okay, yeah. Press that green button with arrow.
Yes, sir.
Nice coming.
Okay, rheumatoid arthritis. Yes, I can see that.
So, good evening, everyone. We had Dr. Maitha from pharmacy, we had Dr. Renu from dental, and Dr. Kalani from dental department, and me from internal medicine. We thought we'll make a theme-based interprofessional education. We had a little bit shortage of time, so pardon us for that. So we identified the learners as MBBS year 4, BDS year 3, and pharmacy year 3. And duration of the session was decided to be 2 hours. And the facilitators will be present from internal medicine, dentistry, and pharmacy. So the learning outcomes for medicine was to able to correlate the pathogenesis of rheumatoid arthritis, able to identify the cardinal manifestations, and able to identify the key investigations to establish the diagnosis and outline the management. For dentistry, they should be able to recognize the clinical features of rheumatoid arthritis related to temporomandibular joint, to identify the oral manifestations like xerostomia and periodontal effects of long-term rheumatoid arthritis, and to outline the management along with collaboration across medicine and pharmacy. For pharmacy, the student will identify, the learner will identify the polypharmacy of rheumatoid arthritis with the side effect profile and reviews the therapeutic plans.
Very good, madam.
Thank you,
Really,
sir.
really good learning outcome and integration. Very good.
And the design was, sir, we have 2 here. One is not, it may not come up to 2 hours because we
Yeah, it's
abruptly
okay.
stopped typing.
Mhm.
So we thought we'll spend introduction and overview 10 minutes. The conduct of the session will have discussion amongst all the 3 group of learners for 40 minutes and presentation by the learners 30 minutes and facilitators inputs or feedback 20 minutes and conclusion 20 minutes.
Right. Good. Comments from other participants? I think, madam, you have really done very well, implemented the concept in the real terms. You might write a scenario for that.
Yes, sir.
And actually you can use this. It seems more or less complete to be implemented.
Okay,
But
sir.
one question for Prof. Lakshmi is there, because they have kept 20 minutes for conclusion. Is it the students' reflections, that they do some
Yes, sir.
post-class assessment?
I have it
something
in
like that?
another slide, Dr. Kalani. Reflection and wrap up, we thought we'll spend 20 minutes. Is it all right, sir? That's the last one, the 4th one.
Okay.
Yeah, I mean, session can be between 2 and 3 hours.
Okay.
Or maybe it's like, so as long as the things are being covered, and
Yes, sir.
actually during discussion, it may take a bit longer.
Yes, sir.
As far as the concept is, I think that's very clearly coming out of this. So you need to have a scenario, and then you have already identified the learning outcomes and the structure there.
Yes.
Yeah, right.
Thank you, sir.
Good. Good.
Thank you.
Can we go to room
Room 1.
1?
Yaman can start there. Yeah, Yaman is there.
Yes, Dr. Yaman is going to present.
I'm fine, but because I stuck, so I don't know where we stop. But I can give a brief, no problem with me.
Yeah, please.
Dr.
Yeah, it's
Vivek and all. Yeah, sure.
not necessary to have a slide.
No problem. I'm really sorry for that. I don't know what happened actually. I'm just
Oh, no,
stuck.
it's all right.
and,
It's all right.
okay. So we decided about a case of a cardiac patient
Okay,
who was post MI, post myocardial infarction.
okay,
Okay, he had what you call the myocardial infarction 6 months ago.
right,
And after that, he started on statins and
right,
anticoagulants and antiplatelets. So aspirin, Plavix, and all were given.
right,
Okay, after the surgery. And then currently, he is approaching a dental clinic,
right,
complaining of because of his poor oral hygiene and so on. So
right.
he get inflammation and all.
All right.
If I'm not mistaken, periodontitis, right, Dr.
Yeah.
Vicky? So
Okay.
yeah. And then the dentist after
I have to learn from a dentist how to pronounce that.
okay. So anyway, so after checking, I mean, the dentist decided that he needs some periodontal, like minor surgery,
Right,
and I think there was some gum bleeding as well.
right.
In order to relate, because he's taking the
Yeah,
anticoagulants and all,
antiplatelets and all that. Yes.
yeah, so bleedings and so on.
Right,
On top of that, because of the inflammation, the infection is there. So the dentist also may need to use some kind of antibiotic.
right,
So this what we were discussing.
right. And then the some measures to control the bleeding.
Exactly.
Yeah.
Ah.
Yeah.
So
Yeah.
did I miss anything? Please help me, Dr. Vicky.
But
Dr.
I
Ong.
think the concept is there because we are not
Yeah.
really looking into the
Yeah. So this is the idea.
knowledge, as long as
So
the concept
from
is there.
pharmacy, yes. So from pharmacy side, the learning outcomes should be like what you call regarding the medication management
Right,
for the INR monitoring, and then if we can adjust the dose or withhold for, how to handle the medication side.
right,
And then, yeah, I missed one point as well. Since the patient requires some antibiotics, so in the scenario, we add that the patient may be allergic to penicillin.
right.
Yeah.
And so the students can pay attention to this point when recommending the antibiotic.
Right. Yeah, so there's a polypharmacy and there is infection and then there is myocardial infarction. And so it brings so all three disciplines together.
Yes.
Yeah, so important would be that if you look at the structure and the conduct of the sessions, so the three cohorts discuss among themselves and then they come together and they present to each other. And finally, they draw a plan for the management of that patient.
Exactly.
Yeah. So
yes.
yeah, that it would be the really interprofessional practice and integrated clinical education.
If I may ask, Doctor, this is considered level 10, right? This is the one you explained to us as level 10?
Yeah, this would be, yes, we are talking about level 10 with the interprofessional. We are bringing different professions together and we are going across the disciplines. Yes, that would be level 10. Yes.
Noted. Thank you very much.
All right. Okay, anybody has any other question? If none, I think we are already towards the end of the session. I really want to thank everybody for your participation and a lively discussion.